Alright, so I'm going to be talking about an article by the FDA that's called FDA Approves New Breakthrough Therapy for Cystic Fibrosis, and this was released in October of last year. So this article is talking about a pretty big breakthrough that they had in the treatment of cystic fibrosis with this new drug called Trikafta. And so this drug, they ran a couple of trials, and the results are pretty promising as far as the treatment of cystic fibrosis. So real quick, cystic fibrosis is a pretty rare but progressive and potentially life-threatening disease that results in the formation of thick mucus that builds up in the lungs and digestive tract. So it leads to respiratory and digestive problems, and you'll see that it leaves the patient susceptible to infection. So you'll see that a lot of these patients are kind of in and out of the hospital, and it's not good. So cystic fibrosis is caused by a defective protein that results from mutations in the CFTR gene. And so there's roughly around 2,000 known mutations of this gene, but the most common that you'll see with cystic fibrosis is a mutation of the F508del mutation. So that's F508del mutation. That comprises about 90% of cystic fibrosis patients, which is roughly around 27,000 people in the United States. So going back to the trials that they did. So the FDA ran a couple of trials last year, and I was actually kind of following along with this because a friend of mine that I went to school with has CF. Was actually a part of these trials, and so she was, documenting kind of her, experiences with it, and she's been able to see quite a big improvement in her quality of life after taking this drug. So they ran two trials, and the patients that they chose just had to be 12 years or older, and then had to have CF, obviously. So the first trial that they ran was a 24-week randomized double-blind placebo-controlled trial in 403 patients who had at least one of those F508del mutations. And then the second trial that they ran was a 4-week randomized double-blind active control trial in 107 patients who had at least two of those F508del mutations. So they're just trying to kind of get a little bit different patient population there. And the results that they saw after these trials were really good. So what they used to kind of judge how well this drug was, how well it was doing in treating, they use, it's called percent predicted forced expiratory volume in 1 second. It's a mouthful. And so they abbreviated it PPFEV1, which is another mouthful. But it's basically an established marker of cystic fibrosis lung disease progression. So it basically measures, the lung capacity and the lung health of the patient. They saw after these trials of people who were taking this new drug, in the first trial they saw a 13.8% increase in overall health from baseline, and then the second trial they saw an overall increase of 10% from baseline. So those may not seem like huge numbers, but with cystic fibrosis, that's really, really good. I mean, what's also really important about this drug is that it's able to treat 90% of the population that has cystic fibrosis, which is a pretty large group of people. So yeah, this new drug, which is called Trikafta, has been proven by the FDA and is approved by the FDA now to treat cystic fibrosis, and the results from these trials have been really promising, and has been a pretty big breakthrough in the treatment of cystic fibrosis. So this article here by the FDA is a pretty good article. If you just look up cystic fibrosis, this is one of the first ones that comes up, and there's quite a few articles about this drug because it's been really important. So yeah, it's really interesting, but really good information. So.